Hello and welcome to a brand new episode of Cafecito con NHCOA. When it comes to vaccines, it is important to keep in mind that immunizations are not just for kids. We all need to get vaccinated at different points throughout our life. That is why it's important for older adults to know what vaccines they may need, where they are administered, and receive encouragement from their trusted healthcare providers and loved ones to get vaccinated. Our next speaker is Dr. Henry Pacheco, a physician and NHCOA's medical advisor, and who will talk with us more about adult vaccines and also the latest information about COVID-19 and its booster shots. Welcome, Dr. Pacheco.
There's a series of vaccines that have been in the schedule for decades, and as you know, this schedule is put out by the CDC. Traditionally, of course, we've had the flu vaccine, which is an annual vaccine that's been there for decades. And we also have the hepatitis B vaccine, some other lesser-known human papilloma. But for older adults, the most important, of course, is the flu, the pneumococcal vaccine, the shingles vaccine, which is very bothersome and sometimes debilitating disease that you can get, and of course the tetanus, diphtheria, pertussis vaccine, with the booster that's recommended every 10 years. Probably the most recent addition to the schedule is the COVID vaccine. So just to recap, COVID definitely, flu definitely, the tetanus, diphtheria, and of course shingles and the pneumococcal vaccine are the most important for older adults, including hepatitis B, of course. For example, COVID vaccine is free and paid by the emergency funding of the federal government. Now, once the emergency funding is stopped, which I think is going to happen if it already hasn't, then the COVID vaccine will no longer be free. Nevertheless, older adults have so many resources to cover the cost of vaccines. Not to mention, we need to mention, of course, the local and state, the local health departments. They have vaccine clinics. Then there's also obviously Medicare Part B that covers vaccines, and Medicaid. So there's really no financial reason not to get vaccinated. They are incredibly low cost. They are graduated to your income, and in some cases, I suppose there's even no charge. The charge is minimal compared to the horrible chance of getting any of these diseases. First of all, there's always the risk of death, disability, and also hospital costs. Hospital and physician costs are incredible. In case of COVID or flu, any hospitalization can be incredibly expensive. So it's money well spent, but in general, it can be gotten at very low fees in those places that I mentioned. As you know, over decades, more and more vaccines have been included into what is required for adults and children. And of course, some order needed to be put into it. And so the CDC is in charge of putting out a schedule. The reason is to standardize these vaccines, but it's also to keep everybody on the same page so that at any given time, both the individual and the healthcare providers, the physicians, can look at their vaccine schedule and see what is lacking, what is needed. And the vaccine schedule is essentially a series of vaccines that are needed, distributed by age, all the way from infancy to adulthood. So it is an important roadmap to getting these vaccines. Now, when a new disease such as COVID comes up, they had to develop this and introduce and insert into the vaccine schedule. And since we had, at least three types of vaccines available: Moderna, Pfizer, they needed to develop a schedule to organize how people are going to know and how healthcare providers are going to know when is adequate coverage obtained. I don't know why there's still a lot of controversy around vaccines. I think vaccines have been around for many years with us, for many decades, since childhood. And, I think we should not forget that COVID has been a very, very vicious disease. And it has already caused over 1 million deaths in the United States since it came out. So since it manifested itself in the United States. And for example, in 2022, last year, way over 250,000 people died because of COVID. So it's still a very, very, very serious disease. And most of the deaths now are among the unvaccinated. So it's very clear that you do yourself a lot of good by getting vaccinated, but not just yourself, but the community. Because, we go out, we have, or at home, we have relatives that are older relatives that are more susceptible. We also have little kids, and we just have a lot of other adults. And at the very least, if getting COVID doesn't, God forbid, kill you, it will set you back, unable to go to work, perhaps doctor visits, expenses. So, and it all, it is a miracle in some ways that we've gotten this vaccine so soon. But it's still a very, very serious disease. There's still, as I said, thousands of deaths reported from this virus. So we're not over it yet. So we now know that, for example, for the COVID vaccine, in most cases, you need the two basic vaccines, the two base vaccines, and then you needed 2 months later the booster. Now the primary series were the two primary series were made of elements of the original COVID virus. So you received two of them several weeks apart. And then I think 2022 or something like that, it came out the need to do booster shots, especially for older adults. And of course, there are also some additional extra conditions for those that have immune suppression, such as folks with cancer or folks taking medications that suppresses their immune system. But in general, there was the need for another booster shot. It was scheduled to be 2 months after the primary series. So far, there's no indication for another booster needed. So, but it could happen anytime because this thing is still evolving. There are some new variants somewhat showing up in other countries. But the first booster shot was simply to reinforce antibody production. And then, as you know, and I can't remember the date, a new variant of the COVID vaccine, the Omicron, came out. So then the folks who manufactured this vaccine made a booster vaccine that included the original plus the Omicron variant. So now most of us have gotten the booster vaccine, at least, that is called bivalent, made up of two viral elements, the original and the new Omicron variant that came out. The name booster already implies that it is to boost, to strengthen, reawaken the immune system. If antibodies are beginning to come down, the booster gives it another, boost, and so that it will be at adequate levels to protect you. It's very, very important to emphasize that we have so much bombardment from radio, television, social media, everything, But most of us would be very safe by simply following what the CDC has to say in terms of vaccinations and what your local health department says. And then you can, Google your health department and get their phone number and talk to them about what you may need or may not need, or any doubts or any questions you have about COVID. But the health departments, the community health centers, are places where one should get information, because they are the more valid sources of information, and not just random pieces here or there, or what your neighbor may say. So very important, because there is a lot of disinformation out there, and so we do have those sources of accurate, valid information that is free, available to us in everywhere in the United States.
Thank you, Dr. Pacheco, for joining us and sharing your knowledge and expertise in today's Cafecito. Before ending, we want to know your opinion. We invite all of you to complete a short survey about this Cafecito episode. For more information, you can access the link provided in this Cafecito and also find it in the description of this video. For more information about the vaccines you and your family should be getting, you can visit www.cdc.gov/vaccines. Also, you can contact us at NHCOA's Research Center at 866-488-7379. Again, we invite you to follow us in our social media platforms for more Cafecitos. As always, we are here to help you. Until the next one.